I want to talk to you today about something that a great many older adults live with, often for years, rarely mention, and usually just accept as part of who they are, yet that occasionally carries an important message about your circulation and even your heart. Hands and feet that are always cold. Your fingers feel icy even in a warm room. Your feet are cold in bed, cold in your slippers, cold when everyone around you is comfortable. You reach out to touch someone and they flinch at how cold your hands are. You pile on the socks, you clutch the hot mug, and still your extremities feel chilled, sometimes pale, sometimes with a slightly bluish or mottled tinge. Most of the time, cold hands and feet are simply that, cold, and nothing more, an ordinary quirk of the body's temperature regulation that becomes more common and more pronounced as we age. But sometimes, cold hands and feet are the visible surface of something happening underneath, in the circulation that carries warm blood out to your fingers and toes, and occasionally that circulation story connects back to the heart. So, today I want to explain why your hands and feet get cold, why this becomes more common with age, the ordinary causes and the ones worth knowing about, what your cold extremities might be telling you about your circulation, what you can do to feel warmer and protect yourself, and, importantly, when cold hands and feet are a reason to see your doctor. And I'll keep this calm and practical, because while I want you to understand when it matters, most cold hands and feet are manageable, and understanding takes away much of the worry. Let me start with what's actually happening, because understanding it makes everything else make sense. Your hands and feet are at the far ends of your circulation, the furthest points from your heart, and they have a large surface area for their size, which means they lose heat easily. To stay warm, they depend on a steady flow of warm blood being pumped out to them through your arteries. Your body also constantly adjusts that flow. When you're cold or stressed, your body narrows the small blood vessels in your hands and feet to keep warm blood in your core, around your vital organs, which is a sensible protective response, but it leaves your extremities cooler. When you're warm and relaxed, those vessels open and your hands and feet warm up. So, the warmth of your hands and feet depends on warm blood reaching them, and on how open or narrowed the small vessels are. Cold hands and feet happen when less warm blood is reaching the extremities, either because the body is narrowing the vessels, which is often normal and protective, or because something is reducing the flow of blood through the arteries, or because the body's temperature regulation is simply more sensitive, all of which become more likely as we age. This is the key idea. Cold hands and feet are, at bottom, about blood flow to the extremities, and that's why, while usually harmless, they can occasionally reflect a circulation problem worth understanding. Let me explain why this becomes more common as we age. Several changes come together. First, our circulation changes. The arteries can become a little stiffer and narrower with age, and the small vessels less responsive, so blood flow to the extremities can be a little reduced. Second, our body's temperature regulation becomes less efficient and more sensitive with age, so we feel the cold more and our extremities cool more easily. Third, we tend to have less muscle and lower activity as we age, and muscle activity generates heat and drives circulation, so less of it means cooler hands and feet. Fourth, the conditions that affect circulation, such as narrowed arteries in the legs, diabetes, and thyroid problems, become more common with age. And fifth, we're more likely to be on medications, some of which affect circulation and can contribute to cold extremities. So, cold hands and feet become more common with age because the circulation and the small vessels change, because temperature regulation becomes more sensitive, because we have less warmth-generating muscle and activity, and because circulation affecting conditions and medications become more common. Much of this is ordinary and harmless, simply the body becoming more sensitive to cold. But because some of it involves the circulation and specific conditions, it's worth understanding which is which, and I'll help you tell them apart. Let me walk you through the causes, from the very common and harmless to the ones worth knowing about. At the ordinary end, and most common by far, is simply a body that runs cold and regulates temperature more sensitively, feeling the cold and narrowing the vessels in the hands and feet readily. This is very common, especially in older adults and in slimmer people, and it's harmless. A related and common pattern is where the small vessels in the fingers and toes over-respond to cold or stress, clamping down so the digits go pale or white, then blue, then red as they warm, sometimes with numbness or discomfort, a well-known pattern of exaggerated vessel response that is often harmless on its own but is worth mentioning to your doctor, as occasionally it's linked to other conditions. Now, the causes worth knowing about. One important one is reduced blood flow through the arteries to the legs and feet, from narrowed, hardened arteries, what's called peripheral artery disease, the same process of artery narrowing that affects the heart. This can leave the feet cold and may come with other signs like pain in the legs when walking that eases with rest, changes in the skin, color, or nails, or slow healing wounds. And it matters because it reflects the health of your arteries generally, including those supplying your heart. Other contributors include an underactive thyroid, which commonly causes cold intolerance and cold extremities, diabetes, which affects the small vessels and nerves, anemia, a low level of blood, poor circulation from a variety of causes, and certain medications. So, while most cold hands and feet are simply an ordinary harmless sensitivity to cold, they can occasionally reflect reduced artery blood flow, an underactive thyroid, diabetes, anemia, or other conditions, which is exactly why persistent, one-sided, or symptom-accompanied cold extremities are worth a doctor's attention. Let me be clear about the connection to the heart and why this matters, because this is a channel about protecting your heart, and the link is real, if often indirect. The most important connection is this: the narrowing and hardening of the arteries that can reduce blood flow to your feet, peripheral artery disease, is the same underlying process, atherosclerosis, that narrows the arteries supplying your heart and brain. So, cold feet from reduced arterial flow can be a sign that your arteries in general are affected, which has implications for your heart and your risk of heart attack and stroke. In that sense, persistently cold feet, especially with the other signs I mentioned, can be a window onto the health of your whole arterial system, including your heart. Additionally, when the heart doesn't pump as strongly as it should, circulation to the extremities can be reduced, contributing to coldness, though this usually comes with other, more prominent symptoms. So, the reason cold hands and feet matter, beyond comfort, is that while usually harmless, they can occasionally signal reduced artery blood flow that reflects the health of your arteries generally, including those feeding your heart, or point to conditions like thyroid problems, diabetes, or anemia worth identifying and treating. That's why understanding your cold extremities and knowing when they warrant checking is genuinely worthwhile. Not to alarm you, but to catch the occasional important cause and to protect your heart and circulation. And it's another reason that the measures which protect your arteries protect your whole self. Now, let me give you the practical things you can do, both to feel warmer and to protect your circulation, because there's a great deal within your control. First, the comfort measures. Keep your extremities and your core warm, since keeping your body core warm helps your body feel safe opening the vessels to your hands and feet. Dress in layers, wear warm socks and gloves, keep your feet warm in bed, and warm your hands and feet gently when they're cold. Keep moving, since activity generates heat and drives circulation, so regular gentle movement, and simply not sitting still for long stretches, genuinely helps keep your hands and feet warmer, and avoid tight footwear or anything that constricts circulation to the feet. Second, and importantly, the measures that protect your circulation and your arteries, which help both your extremities and your heart. Do not smoke, since smoking powerfully narrows the arteries and worsens circulation to the extremities and the heart, and stopping is one of the most important things you can do. Stay active, which improves circulation. Manage your blood pressure, cholesterol, and blood sugar, since these protect your arteries. Eat a heart-healthy diet and maintain a healthy weight, and limit excess caffeine and manage stress, since both can narrow the small vessels and worsen cold hands. Third, take care of your feet, especially given that cold feet can accompany reduced circulation. Inspecting them regularly, keeping the skin cared for, and attending to any wound promptly as poor circulation slows healing, which ties to the diligent foot care that matters so much in later life. Fourth, and crucially, review persistent or concerning cold extremities with your doctor, both to check for causes like thyroid problems, diabetes, anemia, or artery narrowing, and to review any medications that might contribute, so you can feel warmer and protect yourself by keeping your core and extremities warm, keeping active, not smoking, managing your blood pressure, cholesterol, and blood sugar, Eating well, caring for your feet, and having persistent or worrying cold extremities checked by your doctor. These measures genuinely help your comfort and protect the circulation that serves both your hands and feet and your heart. Let me be very clear about when cold hands and feet are a reason to see your doctor, because knowing this lets you tell the ordinary from the worth checking. Cold hands and feet that you've had for a long time, that affect both sides fairly equally, that warm up readily, and that come without other symptoms, are usually just an ordinary sensitivity to cold, and generally nothing to worry about, manageable with the comfort measures. But you should see your doctor if your cold extremities are new or worsening, especially cold feet. If they affect mainly one side, one foot or one hand colder than the other, which can point to a blocked artery on that side, or if they come with other symptoms. Those other symptoms to mention include pain in your legs or feet when walking that eases with rest, or pain in the feet at rest, changes in the color, temperature, or appearance of the skin or nails, slow healing sores or wounds on the feet, numbness or weakness, or the pattern of fingers or toes going white, then blue, then red with cold or stress, especially if it's new, one-sided, or troublesome. You should also see your doctor if you have general symptoms alongside the coldness, such as fatigue, weight changes, or feeling the cold all over, which might point to a thyroid problem, anemia, or another condition. And you should seek prompt attention if a hand or foot becomes suddenly cold, pale, painful, or numb, since a suddenly cold, painful, pale limb can signal a sudden blockage of blood flow that needs urgent care. So, the message is that long-standing, both-sided, symptom-free cold hands and feet are usually fine, but new, worsening, one-sided, or symptom-accompanied coldness warrants seeing your doctor, and a suddenly cold, pale, painful limb is an emergency. Let me paint you a picture of how this commonly plays out. Picture a woman in her 70s whose hands and feet have always run cold, and who's noticed it a little more of late. In the common scenario, when she mentions it to her doctor, she's found to be otherwise well, with the coldness simply reflecting an ordinary sensitivity to cold, made a touch more noticeable by age. She's reassured, and with warm layers, keeping active, and keeping her core warm, she manages it comfortably. But consider a different version. Suppose it was mainly her feet that had become cold over months, and she'd also noticed an aching in her calves when she walked to the shops that eased when she stopped, and the skin on her lower legs looked different. Because she doesn't dismiss it, she sees her doctor, who recognizes the possibility of narrowed leg arteries, assesses her, and identifies peripheral artery disease, an important sign of arterial health that prompts treatment to protect not just her legs but her heart, with attention to her smoking, blood pressure, cholesterol, and activity. In both cases, understanding her cold extremities, knowing the ordinary pattern and the features that warrant checking led to the right outcome, whether that was simple reassurance or the catching of an important sign for her whole cardiovascular health. That contrast is exactly why cold hands and feet, usually harmless, occasionally deserve a closer look. And let me speak briefly to those of you caring for an older person. You might notice a loved one's hands or feet being persistently cold, or them always feeling the cold, or changes in the color or condition of their feet. You can help by understanding that while cold extremities are usually just sensitivity to cold, they can occasionally reflect circulation problems, thyroid issues, diabetes, or anemia, and by encouraging the comfort measures, keeping warm, staying active, and caring for the feet, while supporting the heart protective measures like not smoking and managing blood pressure and cholesterol. And you can help watch for the features that warrant a doctor, new or one-sided coldness, leg pain on walking, skin or wound changes, or a suddenly cold, pale, painful limb, and encourage timely care. Helping a loved one stay warm and, when needed, get their circulation checked can ease their discomfort and occasionally catch something that matters for their heart. Let me draw this all together. Hands and feet that are always cold are, at bottom, about how much warm blood is reaching the far ends of your circulation. And while most cold extremities are simply an ordinary, harmless sensitivity to cold that becomes more common with age, they can occasionally reflect reduced artery blood flow, an underactive thyroid, diabetes, anemia, or other conditions. The most important connection is that the artery narrowing which can leave the feet cold is the same process that affects the arteries to your heart and brain. So, persistently cold feet, especially with other signs, can be a window onto your whole arterial health. So, here's what I'll leave you with. First, understand that cold hands and feet are about blood flow to the extremities, usually just a harmless sensitivity to cold, but occasionally a sign of a circulation or other condition. Second, know the reassuring pattern, long-standing, both-sided, symptom-free coldness that warms readily is usually fine. Third, know the features that warrant seeing your doctor, coldness that's new, worsening, or one-sided, or that comes with leg pain on walking, skin or nail changes, slow healing wounds, numbness, color changes in the digits, or general symptoms like fatigue or feeling cold all over. And seek urgent care for a suddenly cold, pale, painful limb. Fourth, feel warmer and protect yourself by keeping your core and extremities warm, staying active, not smoking, managing your blood pressure, cholesterol, and blood sugar, eating well, and caring for your feet. And fifth, remember that protecting the circulation to your hands and feet means protecting the same arteries that feed your heart, so the warmth of your extremities and the health of your heart are more connected than they seem. So, take care of yourself. Keep warm, keep moving, look after your arteries, and pay attention when your cold hands and feet come with anything more. And because identifying any circulation, thyroid, or other cause needs a doctor's judgment, please treat new, worsening, one-sided, or symptom-accompanied cold extremities as your reason to see your own physician, and seek urgent care for a suddenly cold, painful, pale limb, rather than simply accepting cold hands and feet without a thought.